Today, we are going to talk all about prioritization questions. So hopefully by the end of this webinar, you guys feel much more comfortable when you're sitting down to take prioritization questions, whether you're at school or whether you're taking the NCLEX. Hopefully you feel much more confident. Briefly, I'm going to tell you a little bit about myself. I'm Dr. Amber Adams. I'm one of the nurse educators here at bootcamp.com. My nursing experience is primarily in emergency nursing. So as you can imagine, I've had a lot of prioritization experience over the years. I've been a nurse for about 15 years, and I've been here at bootcamp for a couple years and absolutely love helping students get prepped for NCLEX. Today, we are going to talk all about prioritization. We're going to talk about how we should approach the prioritization process, and we're going to review some general principles of prioritization so that you can navigate prioritization items very strategically. And before I forget, I do want to introduce my moderator today. I have Miriam with me. She is another wonderful nurse educator that's going to be in the chat. She'll be answering any questions that you guys have. And I do want to let you know there is a little bit of a delay with the chat box. So if it takes us a couple minutes to answer you, we're not ignoring you. It just takes a little while for us to see it on our end. So the reason that we are talking about prioritization today, and the reason it is such an important topic, is you are guaranteed to see prioritization items on NCLEX. We all know by now that the NCLEX is a safety exam. So one of the best ways they can determine if you are a safe nurse is to assess your critical thinking. And one of the best ways to do that is through prioritization questions. Because prioritization questions typically don't just look at one client or one clinical condition. Instead, they are asking you to just look at the overall picture and progression that you expect for sometimes 4 clients. So they can be much more challenging than other items. But once again, hopefully today we make it a little bit more simpler. Also, I want you guys to know that prioritization questions are formatted many different ways. You may be asked to identify the highest priority or the most sick client, or you may even be asked to identify the least sick or the lowest priority client. So it's always very important to pay close attention to what that question is asking you. And also, I just want to remind you guys that priority setting is going to be a skill that you're going to use every day in practice. So it's important to continuously practice this skill and get better at prioritization because you're going to be using it every day. So before we jump into these practice questions, I want to briefly review a really good resource that we have here at bootcamp.com. It's our prioritization pyramid that we worked really hard on. And this pyramid is supposed to help you as you sit down to take these prioritization questions, navigate them using a very strategic approach to help guide you. So the way we use this pyramid is we start with step 1 on the left here, and we are going to eliminate any type of stable or chronic issues. So typically any client that is experiencing chronic ongoing issue or they are stable is not going to be our first priority. They're not going to have any type of life-threatening emergent issue that requires immediate care. So let me give you an example of those. A stable client is a client that perhaps has a sprained ankle and they have good pulses. There's nothing that would indicate that that client has any type of life-threatening risk or urgent need. Whereas a chronic issue might be a client with maybe advanced COPD and they have a pulse oximetry reading of, let's say, 93%. Would we expect a client with advanced COPD to have a pulse oximetry reading of 93%? Yes or no? I'm saying yes. Typically, these clients are going to have much lower pulse oximetry readings than a client without any type of respiratory illness. So this is a chronic issue that typically is not going to be too concerning. So once we're able to eliminate those stable and chronic issues over here on the left, we're going to move to step 2, which is our pyramid. And it's going to help us guide us to figure out what is truly the highest priority client or the most sick client. So starting at the bottom of our pyramid, we have airway and safety issues. So airway issues might be stridor. Maybe that client has inflammation of the airway, which we know is a huge concern. Or maybe they have a safety issue, maybe suicidal ideations with a plan. It's something that if we don't intervene right now, there is an immediate life-threatening risk to that client. So that's typically going to be our number 1 highest priority, followed by breathing, circulation, and disability. And disability is just a fancy way to say neurologic, so maybe stroke symptoms. And then our lowest priority issues are typically going to be up here at the green portion of our pyramid. That's going to be routine tasks or routine orders, expected findings, and psychosocial needs. An example of a psychosocial need is maybe our client is anxious or frustrated. And certainly we want to use therapeutic communication, address their needs, but it's typically not going to pose any type of life-threatening risk. So I know that was a lot. I just threw at you guys with that pyramid, but that's really laying the groundwork. And we're going to use this pyramid as we navigate these next couple of practice questions. So let's get into the first question. The medical surgical nurse is assigned the following clients. Which client should the nurse see first? So once again, pay close attention to your stem of the question and what it's actually asking you, because these prioritization questions, once again, are formatted in many different ways. So let's look at our option. A client with pneumonia who has just arrived on the unit, a client with stage 4 colon cancer who has a pain level of 5 out of 10, a post-operative client who is waiting with his wife for discharge education, and a client with a small bowel obstruction whose NG tube is reported as not draining by the unlicensed assistive personnel. So let's look a little closer. We have a client with pneumonia who just arrived on the unit. So if we look over here at our pyramid, we know that pneumonia can pose a breathing issue, which is of course a concern, but there is something even more concerning about option 1. Can you guys tell me what has you concerned about option 1 besides the pneumonia? What do we think? And this is the reason I chose this question for the webinar today, is this is a very, very important teaching point, kind of an NCLEX tip. Eliza, very good, just arrived. Princess, very good. Y'all are right on target. Anytime you see the word just arrived on the unit, that once again is a very high priority patient. They have not yet been assessed and they are considered unstable because we really don't know how they look clinically. We haven't seen them. So we know right away that option 1 is a very high priority, but let's look at the other options and see if anyone is a higher priority. So option 2, stage 4 colon cancer with a pain level of 5 out of 10. Moderate pain, 5 out of 10. So remember, stage 4 cancer is typically advanced and there typically is metastasis. So do we expect a pain level of 5 out of 10 for a client with stage 4 cancer? So once again, we typically have metastasis, we might have multiple tumors. So unfortunately, we do anticipate some pain. So that is what we would call an expected finding over here in our pyramid. So at the very top in green. So that's an expected finding and we certainly want to treat their pain, but they are not the highest priority client so far. Option 3, a post-operative client who is waiting with his wife for discharge education. What do you guys think about that? Are y'all concerned about the client in option 3? Well, I don't know about you guys, but I'm typically not in the habit of discharging unstable clients. So we know right away if this client is waiting for discharge education, they are stable. So we can go ahead and eliminate them as the option they can wait until after we see the higher priority clients. And then option 4, the client with a small bowel obstruction with an NG tube that's not draining. Right now, based on what we have, this client is also stable. However, I would say if I was trying to make a plan as the nurse, option 4, I'd probably see second. Because if we see this is not an expected finding, and if we leave that NG tube not draining, our client is at risk for complications. They could have abdominal distension and discomfort, nausea, vomiting, and even rupture. But once again, they are not going to be as high of a priority as a client that just arrived on the unit. So you guys were right on target. So let's see if we got it right, and we did. And if you did, I want you to note you're doing pretty well because about 55% of students that practiced this question got it correct. So great job, guys. So now let's look at question 2. The nurse is made aware of the following client situations. The nurse should first assess which client. So once again, this is another one of these priority questions that is asking us to identify the highest priority or most sick client. So let's look at our options. We have glaucoma surgery reporting nausea and constipation, a client with right-sided thoracotomy that has 9 out of 10 pain with inspiration and coughing, laparoscopic cholecystectomy or gallbladder removal that's reporting 6 out of 10 right shoulder pain, and a client that had a reduction of a dislocated shoulder and has numbness and tingling of the fingers. So what do you guys think? So looking a little closer, in option 1, a client that had glaucoma surgery and is reporting nausea and constipation, we know that following any type of surgery, you can experience some nausea, some GI issues from anesthesia. And at this time, this client is stable and has some expected findings. Now, here is where I want to go ahead and give y'all another helpful NCLEX tip. Don't read into options. I used to do this as a student. It's very easy to do, but we want to be careful. Sometimes we go down a rabbit hole, is what they call it, where we might see glaucoma surgery, and we know post-operatively a client with glaucoma surgery, we need to closely monitor their intraocular pressure. And so we might be thinking, oh no, nausea, they could vomit, that could increase their intraocular pressure, that could be concerning, but we don't want to go down those rabbit holes. Let's just look at what they gave us, and right now that's kind of expected post-operatively, and it's a pretty stable client. So option 2, right-sided thoracotomy with 9 out of 10 pain with inspiration and coughing. So if y'all recall, that thoracotomy is just an incision in the chest wall. Post-operatively, these clients typically have severe pain. That's why we have to watch them very closely for post-operative complications, because it's very painful for them to cough and take deep breaths. So they're at risk for atelectasis, pneumonia, that type of thing. But it is an expected finding after the surgery. The client, once again, typically has very severe pain. So that's also an expected finding. And then option 3, the laparoscopic cholecystectomy with shoulder pain. So this is a little pop quiz for you guys. This is a very common post-operative side effect of any type of laparoscopic surgery. Why would a patient that had a laparoscopic surgery to the abdomen have shoulder pain? Can somebody tell me? And this is a very good distractor that you may see on these types of questions. So if we'll recall, a laparoscopic procedure typically involves them inserting carbon dioxide gas into that abdomen, so they're able to see better, to visualize. And whenever we have that CO2 gas injected in there, sometimes it stays. So you can have some trapped in there, trapped gas. So good job, Daisy. You said inflate the abdomen with gas. You are right on target, guys. So when this gas gets trapped, it can put pressure on the phrenic nerve and you get some referred pain to the shoulder. So this is actually a very common post-operative finding for clients that undergo laparoscopic surgeries like this. So this is also actually an expected finding. Can be very uncomfortable, so a lot of times we want to let that client walk around and hopefully get that gas to dissipate. So moving right along, option 4, which is what you guys are guessing. So let's talk about why that's probably the best option. We have a client that just had a dislocated shoulder repaired, and now they're experiencing numbness and tingling of the fingers. So anytime you have a client with any type of musculoskeletal issue, whether they have had a fracture, whatever the case may be, we always have to worry about the neurovascular compromise that can happen with any type of inflammation or injury. So we want to closely monitor the neurovascular status distal to the injury. So if a client has an injured shoulder, we would want to closely check their hand, their fingers, to make sure we have good perfusion. So anytime you have a client with an extremity injury and distal to that injury, you are seeing numbness, tingling, maybe it's pale or it's really cold. Those are all signs that the area is probably not getting enough blood flow, and that can be very concerning. And if it's not addressed, you can lose the limb. So that is a very high priority. So once again, if we look over at our pyramid, option 4 is a circulatory issue. So that makes it the highest priority. Compartment syndrome. Great job, guys. Yes, you can have compartment syndrome when you have increased pressure in that compartment and you won't have enough blood flow. And absolutely, it's a medical emergency. Natasha, 6 Ps. I love it. So if you got that correct, great job, because about 59% of students that did this practice question got it correct. So last one, and with this one, I wanted to totally switch gears. I told you that prioritization questions might be formatted many different ways, so I wanted to give you a big contrast. We're gonna now be looking for the least sick or lowest priority client. So it says the nurse is caring for admitted clients involved in a mass casualty incident. The nurse must discharge a client to make a bed available for more injured clients. It would be most appropriate for the nurse to recommend discharging which client. So once again, we are looking for the lowest priority client. Now I'm gonna go ahead and tell you guys, this question is much easier than the other two, but I chose it for a really good reason, because all of the answers have very high yield conditions that you're likely to see on NCLEX. So even if you're like, I know the answer, pay close attention because there's going to be a lot of learning here. So option 1, a contusion to the chest wall with a heart rate of 110. Option 2, soot around the nose and mouth with a respiratory rate of 30. Option 3, a headache and bruising behind the ear following a head injury. And option 4, superficial non-bleeding abrasions to the face and upper extremities. So I know you guys are all guessing 4, but let's talk about these other 3 conditions that once again you are likely to see on NCLEX. So option 1, a contusion to the chest wall, so bruising to the chest wall with a heart rate of 110. So we know that that heart rate is just a little fast, they're a little tachycardic. So if you have a client coming in with a chest wall injury that is tachycardic, tell me, what are you guys worried about? What conditions are you worried about? So I'm worried about cardiac tamponade, okay? And also I could worry about pneumothorax. Both of these things are absolutely life-threatening conditions that can occur whenever you have an injury directly to that chest wall. With cardiac tamponade, for example, you're gonna have swelling in that pericardial sac, so that heart's not pumping as efficiently, and you're gonna start seeing signs of inadequate cardiac output. You're going to see tachycardia, you're going to see hypotension, those types of things. So that is not a client I want to discharge. Now I want to go ahead and note, I see a couple people are guessing option 2 is the right answer. So remember, read your stim very, very closely. It's easy to get confused. You're probably looking right now for the highest priority, and once again, it's asking us for the lowest priority. So pay close attention to that stim. It can get you in trouble. So soot around the nose and mouth with a respiratory rate of 30. So we know that that client is a little tachypnic. The respiratory rate's a little high, and this is a big old NCLEX tip. If you ever have a client that has soot around the nose or the mouth, or maybe whenever they're coughing, their sputum is gray or soot tinged, that is a sign of what? Inhalation injury. Very, very bad. So what happens is you breathe in that smoke. Smoke is an irritant, and sometimes the client will look stable at first, but that swelling in the airway is just going to progress and get worse. And as a result, a lot of times these clients will require intubation to maintain that airway. So that is a very high priority, life-threatening emergency. A pyramid over here. So we got 1, we got 2. Both of those are certainly people I don't want to discharge. Option 3, a headache and bruising behind the ear following a head injury. So does anybody remember the name of that bruising behind the ear? What's it called when you have bruising behind the ear following a head injury? While y'all are guessing that, thank you guys. Y'all reminded me that singeing of the nasal hair is also a very common finding with inhalation injuries. So that's another finding that indicates inhalation injury. Great job, Daisy. Battle sign. So yes, we are worried about a basilar skull fracture. Great job, Caprice. Basilar skull fracture. Anytime you see that bruising, we are worried about a skull fracture, and we know with that can come increased intracranial pressure, neurologic compromise. So we're going to put it over here on our disability on our pyramid. And once again, somebody I don't want to discharge. So option 4, we have a client that has non-bleeding abrasions to the face and upper extremities. So maybe they need some Neosporin and some wound care, but they can go out the door, huh? They are stable. So once again, I know that one was a little bit easier, but please remember those findings that we discussed in options 1 through 3, because they are, once again, very high yield, emergent findings that if you see, you're gonna want to attend to that client very quickly. Okay, I'm so impressed with you guys today. Y'all are awesome. So before I go, I want to remind you guys that here at bootcamp.com, we've been working super hard on some cheat sheets, and we have one devoted to prioritization. You will find the pyramid there, but you will also find a lot of other resources we don't have time to talk about today, including determining what is acute versus chronic, what is stable versus unstable. Certainly, please check those cheat sheets out. They've been helping a lot of students prep for NCLEX. And also, Miss Miriam, I know, is probably dropping the link to our socials. Please follow us, check us out so you can attend future webinars. We typically have them weekly. So I hope today that this information helped you. And now, whenever you are taking prioritization questions on the NCLEX, hopefully they are a breeze and you feel very confident. So thank you guys so much again for attending today, and I hope y'all have a wonderful rest of your week. So next week, Wednesday the 19th, we're going to go over bow tie questions, which I know some people don't have a lot of experience with, so they can be kind of intimidating. And it's going to be at 2:30 Eastern Standard Time. Thank you, Miss Miriam. Okay, guys, well, I hope you have a wonderful rest of your day, and thank you again for joining us.